Hi, I'm Dr. Kim Rio, and I'm here today to answer some questions about jaw popping and clicking. You know, a lot of people experience this problem, and sometimes it's accompanied with pain, and sometimes it's just an annoying noise. So a lot of people think that that popping sound is the sound of the joint coming out of place, but actually the popping comes from the joint going into place. This is a model of what the jaw and how it relates to the bottom of the skull. So this is the lower jaw with the teeth, and this little part up here is called the condyle. It's a little protrusion up there at the top, and it sits next to the bottom of the skull. Now ideally these two are lined up, but in people that have joint popping and clicking, it usually sits like that. The joint is actually just a little, the disc is just a little bit forward of the joint. This little yellow piece of plastic symbolizes the disc, and so the sound comes from when we open our jaw. The condyle actually pops onto the disc there, and then as we open our jaw further, the condyle moves down this little eminence in the skull like that. That's called translation. When the jaw goes back closed again, it hits the back of this and then pops off the disc. In some people, you can hear that happening as the jaw pops off the disc, but usually you can only hear it when it pops on the disc. So again, you open, popping onto the disc, and then move through translation, come back and pop off the disc. So what we recommend is if somebody's having trouble with their jaw joints, we will actually make a splint. And what that does, this symbolizes our little splint, and what that does is it sets up the jaw joint so that the condyle can be aligned in the proper point of the fossa and actually keep the disc in between there. This keeps all the tissues much healthier, as well as keeping this condyle off of the delicate tissues that exist behind the disc up in this area. So when people open and close, it stays on that disc a little bit better once you have a splint in. So that again is how the splint can help with temporomandibular joint pain and that disc dislocating off there. I'll be checking in again to give you updates on different therapies that we can do to help with temporomandibular joint pain. Have a great day. Bye.